Now, what is autonomy? Autonomy in nursing refers to the nurse's ability to appreciate their patient's rights to medical information and treatment while making decisions independently of the healthcare provider. Now, mutual patterning respects autonomy by allowing patients to actively participate in their choices about their care, rather than being passive recipients of treatment. Informed consent. Informed consent is a process of communication between a patient and a healthcare provider that results in the patient's agreement to undergo a procedure or treatment, and it is both a legal and ethical obligation. Martha E. Rogers, born on May 12, 1914 and died on March 13, 1994, and she was an American nurse, researcher, theorist, and author widely known for developing the science of unitary human beings and her landmark book, An Introduction to the Theoretical Basis of Nursing. Now, her knowledge about the concurrence of the human being and his or her environment played a big part in the changes towards a better health. In her early life, she developed an appreciation for reading and was introduced to the public library at the age of 3. By the 4th grade, she had read every book in the library. Rogers mastered the Greek alphabet at the age of 10, and by the 6th grade, she had read all 20 volumes of the Child's Book of Knowledge and was reading the Encyclopedia Britannica. She also enjoyed reading some themes such as anthropology, ethnography, psychology, and aesthetics that served a future purpose in her theory on the science of the unitary human beings. She earned her nursing diploma from Knoxville General Hospital in 1936 and received her degree in public health nursing in 1937. She was awarded her master's degree from Teachers College, Columbia University in 1945, and in 1954 she earned her doctorate in nursing from Johns Hopkins University. Now, her doctoral dissertation focused on associations between maternal and fetal factors and behavioral issues in children.
Okay, so now that we have learned about Martha Rogers' early life and education, we can now dive into learning about her professional journey and all the contributions she has made in the nursing field. So Martha Rogers built a strong educational foundation. She went on to establish an outstanding professional career and made significant contributions to nursing theory and practice. Her work reflected a commitment to advancing nursing education, leadership, scientific understanding, and leaving a lasting influence on the profession worldwide. From George Peabody College in 1937, Martha Rogers worked as a public health nurse for the Children's Fund of Michigan for 2 years. In 1940, she joined the Visiting Nurse Association in Hartford, Connecticut, where she serves as an assistant supervisor, assistant education director, and acting director of education. During this time, she completed her Master's of Arts at Teachers College, Columbia University in 1945. After earning her master's degree, she became executive director of the Visiting Nurse Service in Phoenix, Arizona between 1945 to 1951. Believed to be the first nurse in the state with a master's degree, and developed the visiting nursing services there. So while pursuing her doctorate at Johns Hopkins University, she also served as a visiting lecturer at Catholic University in Washington, D.C. Upon completing her doctorate, Rogers was appointed professor and head of the Division of Nursing at the New York University, where she led the program for 21 years, revitalizing the faculty and advancing nursing education. She was a fellow of the American Academy of Nursing and remained active in the professional nursing organization. Even after retiring in 1975 and becoming Professor Emerita in 1979, she continued teaching, presenting internationally, and mentoring nurses all around the world. Now, this leads to her legacy and contributions. Martha Rogers made enduring contributions to nursing through her theory, publications, and scholarships. She developed the science of unitary human beings, a nursing theory that emphasized holistic, patient-centered care and the dynamic interaction between humans and their environment, introducing the 4 Rogerian principles of homodynamic. She authored several influential books, including Educational Revolution in Nursing, which was published in 1961, Reveille in Nursing in 1964, An Introduction to Theoretical Basis of Nursing in 1970, Nursing Science and Art, A Perspective in 1988, Nursing Science of Unitary Irreducible Human Beings Update in 1990, and Vision of Space-Based Nursing in 1990 as well. Rogers also edited the journal Nursing Science, promoting nursing scholarships and research. Her work has had a lasting impact on nursing education, research, theory, and practice worldwide, shaping generation of nurses and the discipline as a whole.
On to Martha Rogers' theory. Now, Martha Rogers is best known for her nursing concept, the science of unitary human beings. Her approach highlights the profound connection between a person and their surroundings. She saw nursing as both a science and an art, with a humanistic and humanitarian focus. Her theory incorporates fundamental concepts such as energy fields, openness, patterns, and changes over time. Now, according to Rogers, the science of unitary human beings is divided into two dimensions: the science of nursing, which is knowledge specific to the field of nursing derived from scientific research, and the art of nursing, which is a creative application of the science of nursing to improve patients' lives. Now, the belief in human and environmental coexistence has had a significant impact on the process of health improvement. And in summary, a patient cannot be separated from their environment when addressing health and treatment. This viewpoint paved a way for Martha Rogers' theory, which allowed nursing to be considered one of the scientific disciplines. Moving on to the 5 assumptions of her theory. Now, according to Angela Gonzalez, there are 5 assumptions of her theory, and they are: man is a unified whole possessing his own integrity and manifesting characteristics that are more than and different from the sum of his parts. The life process evolves irreversibly and unidirectionally along with the space-time continuum. Man and the environment are continuously exchanging matter and energy with one another. Being pattern and organization identify the man and reflect his innovative wholeness. And the last one is: man is characterized by the capacity of abstraction and imagery, language, thought, sensation, and emotion.
So this is one of Martha Rogers' greatest contributions, which is the science of unitary human beings. This is a theory and it's an 8-concept framework that changed how nurses view and care for patients. The first concept is the energy field. The energy field is a fundamental unit of both living and the non-living. It provides a way to view people and the environment as irreducible wholes. The energy field continuously vary in intensity, density, and extent. So this just means that people and their environment is made up of energy that's always changing. It shows that we can separate a person from what they are around or from what's around them. Openness. There are no boundaries that stop energy flow between human and environmental fields. Openness in Rogers' theory refers to qualities exhibited by open systems. Human beings and their environment are open systems. So this means that there are no walls or limits between people and their environment. Energy is always moving and flowing between them. The third concept is pandimensional. Pandimensionality is defined as a non-linear domain without spatial or temporal attributes. Humans' parameters to describe events are arbitrary, and the present is relative. There is no temporal ordering of lives. This means that things don't always happen in a straight line or fixed time. Everything in life is connected in ways that we can't always measure. The fourth concept is pattern. Rogers defined the pattern as the distinguishing characteristics of an energy field seen as a single wave. It is an abstraction and gives identity to the field. So this is what makes each person unique. It's like your own fingerprint that shows who you are and how you connect with the world around you. The principle of homeodynamics. Homeodynamics should be understood as a dynamic version of homeostasis. Homeodynamic principles postulate a way of viewing unitary human beings. The 3 principles of homeodynamics are resonance, helicy, and integrality. So this is just basically saying that people are always changing and growing and not staying the same, kind of like a moving balance instead of a still one. The 6th concept is resonance. It speaks to the nature of the change occurring between human and environmental fields. The life process in human beings is a symphony of rhythmical vibrations oscillating at various frequencies. It identifies the human field and the environmental field by wave patterns, manifesting continuous change from longer waves of a lower frequency to shorter waves of higher frequency. So this means that people and their environment are always sending and receiving energy like waves or vibrations. These waves change all the time, sometimes slow and calm, other times fast and active, showing how life is always moving and ever changing. Is helicity. The human environment field is a dynamic open system in which change is continuous due to constant interchange between humans and the environment. This means that people and their environment are always changing together. Change never stops. It's continuous because we're always interacting with what is around us. And our last concept is integrality. Because of the inseparability of human beings and their environment, sequential changes in the life processes are continuous revisions occurring from the interaction between human beings and their environment. This means that people and the environment cannot be separated. We're always connected, and the change in one will affect the other. Life is a constant mix of both working together. We're going to be speaking about the application of her theory. So, Rogers' nursing science provides nursing with knowledge about human beings and their health that is of great value in any nursing care situation. By recognizing the interconnectedness of nurses and their professional environments, her theory reinforces the idea that success in the field is achieved through dynamic participation, collaboration, and the continual exchange of knowledge and energy. Through active involvement in the association, nurses can advance their personal careers and contribute to the collective progress of the nursing profession as a whole.
Health promotion. Rogers' theory states that she believes that a patient can never be separated from their environment when addressing health and treatment. Her knowledge about the coexistence of humans and his or her environment contributed a lot to changing towards a better health.
So, holistic and humanistic care. Rogers presents a humanistic and holistic view of nursing, describing the human being as a synergistic unit in constant interaction with the environment. Her principles such as integrality, resonance, and helicity emphasize the continuous dynamics between the human and environmental fields. Human and environmental energy fields are open and fluid systems in continual interaction and influencing energy balance.
Palliative care. Her theory is used by nurses to manage not only physical pain but also to create an environment that enhances the emotional well-being of the patient. And some techniques include calming sounds, soft lighting, or aromatherapy to reduce stress and discomfort.
Mental health. Palliative care involves more than just managing medical symptoms. It also addresses the psychological, social, emotional, and existential aspects of illness. It highlights the need for psychology and, by extension, mental health nursing in assisting patients in dealing with stress, loss of identity, role changes, end of life difficulties, and the emotional turmoil of serious disease.
Good morning. Shante Grant. I'm your nurse today. What's her name?
Shanique,
What is one?
her sister, she needs to see the doctor now. She can't breathe.
What's her age?
20.
How long have you seen some started?
A few hours ago.
Do you have any pain in your chest? Yes. From a scale of 1 to 10, how bad is it?
It's about a 9.
Okay, so this pain, I'm going to do some breathing techniques. I want you to do an inhale and exhale. And so you can calm until I get the doctor. I want you to do it consciously until the doctor comes, okay?
Should care, right?
Yes.
Alright, Miss Kim, what are you feeling at this moment?
A little better.
You're feeling better?
Yes.
Alright, that's great to hear. Alright, so based on the examination that was done, your asthma is currently was in a severe exacerbation, which means your airways were significantly narrowed and inflamed, and this is serious, and you need to take quick procedures as it relates to that, alright? So we do have a main drug that we would use, which would be corticosteroids. It would be taken long term due to your severe asthma. This will result in dilating your airways, so it would be easier for you to breathe on an everyday basis, okay? Alright, so this a risk factor. So yes, there is a risk factor. Alright. So the nebulization of the inhaler, it would make you feel a bit shaky and your heart might race for a few minutes, but that's a common side effect, okay? And it will go away.
Okay.
Yeah. So is there anything you have to say about that?
Yeah, the risk factors. Why? I'll definitely think about it. I'll decide right now, or can I think about it and come back?
Yes, you can. But there's also other alternatives if you don't want to take the plastic conference.
Which type?
Montelocast, and you also have Zalferlocast. Okay, these are chemical mediators which blocks leucokinase, which are inflammatory chemicals which are released by the body that cause your bronchial constrictions and swelling to reduce the inflammatory energy field. Okay.
Okay.
The corticosteroids are the most effective and safest long-term inflammatory inhaler that we have for asthma patients. So you can make your decision as it relates to which one you would like to take.
Okay. I'll definitely think about it for sure.
Okay.
Okay.
So, Miss Carey, I could see that you're in some sort of distress. Can you inhale and exhale for me, please? After 3, 1, 2, 3. Inhale. Exhale. Again, inhale. Exhale. Are you able to speak now? Okay, so what's bothering you specifically?
Well, think about the doctor mentioned to me regarding the medication I have to proceed with for it's gonna be long term. About my lifestyle. What about what I have to do, what I'm used to? I'll make all those certain changes. Like for example, I'm used to smoking, not to cut that out or reduce it. I just don't know. I don't know.
I understand what you're saying, but just look at the bright side. By taking this medication, it could clear your airway, reduce the inflammation, and stop you from going to the doctor constantly, which could lead to hospitalization. I like how you're your sister, you're supporting you. Maybe you could talk to her sometimes, or you could come back to us, and you could talk to our psychologist and our group session therapist. Is that okay with you?
Yeah, they are. I'll definitely have time. I was remembering to think about it, and I'll make my decision for sure.
Okay, we'll leave you to make your decision. I'll be back in a few, okay? Miss Mary,
Oh, hi, nurse.
are you still feeling any chest pain, difficult breathing?
No, not so
Okay.
far.
I'm happy.
Indeed.
And yeah. So very okay, alright.
Yes. Good.
You made a decision, okay?
Yes.
Alright, so that's good. So we have a nurse here as a witness to sign a consent form as it relates to the medication, the drugs, the corticosteroids that we've been taking. That would benefit you in the long run. So the nurse will have you sign this consent form and we'll simply confirm that we had this discussion and you understand our treatment, okay? Alright, so you can go ahead and read through the consent form and sign where the system has it. Alright, so I will sign here as well. Alright, so we'll have the nurse as a witness to sign off as it relates to. Alright, Ms. Carey, I'm glad you made the right choice and we'll be here to support your journey as it relates to this. So this will improve you on a daily basis, okay?
Okay.
I'm
Alright.
happy that you made the right choice.
Indeed. Thank you guys so
All right,
much.
you're welcome.